Heart failure remains a leading cause of morbidity and mortality worldwide, with current treatment options primarily focusing on symptom management and slowing disease progression. However, regenerative medicine, particularly the use of stem cells, offers a promising avenue for developing more effective treatments. This article delves into a groundbreaking study published in The Lancet that demonstrated the use of stem cells in treating heart failure, providing a detailed analysis of the scientific evidence supporting this innovative approach. Overview of heart failure. Heart failure is a chronic condition where the heart is unable to pump blood effectively to meet the body's needs. It can result from various underlying conditions, including coronary artery disease, hypertension, myocardial infarction, and cardiomyopathy. Traditional treatments include lifestyle changes, medications, and in severe cases, mechanical support devices or heart transplantation. Despite these interventions, many patients continue to experience significant limitations and a poor quality of life, highlighting the need for novel therapeutic strategies. Stem cells in regenerative medicine. Stem cells are undifferentiated cells with the unique ability to self-renew and differentiate into specialized cell types. This potential makes them ideal candidates for regenerative medicine, aiming to repair or replace damaged tissues and organs. Several types of stem cells are being explored for their therapeutic potential in heart failure, including embryonic stem cells (ESCs), pluripotent cells derived from early-stage embryos, adult stem cells, multipotent cells found in various tissues, including bone marrow-derived mesenchymal stem cells (MSCs) and cardiac progenitor cells. Induced pluripotent stem cells (iPSCs), adult cells reprogrammed to a pluripotent state, capable of differentiating into any cell type. The landmark study in The Lancet, a pivotal study published in The Lancet in 2011, explored the use of stem cells for treating patients with severe heart failure. The study, titled Intracoronary Cardiac Stem Cell Infusion in Patients with Ischemic Cardiomyopathy, a randomized, double-blind, placebo-controlled trial, was conducted by a team of researchers led by Dr. Roberto Bolli. Study design and methods. The study was designed as a randomized, double-blind, placebo-controlled trial, ensuring high scientific rigor and reliability of the results. It involved 33 patients with ischemic cardiomyopathy, a condition characterized by severe left ventricular dysfunction due to prior myocardial infarction. The patients were randomly assigned to receive either intracoronary infusion of autologous cardiac stem cells (CSCs) or a placebo. Patient selection: patients with a left ventricular ejection fraction of 40 and significant myocardial scar tissue were included. Stem cell isolation and preparation: autologous CSCs were harvested from the patient's own heart tissue via endomyocardial biopsy. The cells were then expanded in culture to obtain sufficient quantities for infusion. Intracoronary infusion: CSCs were infused directly into the coronary arteries, supplying the infarcted myocardium using a catheter-based approach. Follow-up and assessment: patients were monitored for 12 months, with assessments including cardiac magnetic resonance imaging (MRI) to evaluate changes in length, scar size, and myocardial mass. Additionally, clinical outcomes such as exercise capacity and quality of life were measured. Results: the study yielded promising results, demonstrating the potential of CSCs to improve cardiac function and repair damaged heart tissue. Key findings included improvement in left ventricular function. Patients who received CSC infusions showed a significant increase in length compared to the placebo group. On average, length improved by 8.2 in the CSC group, whereas the placebo group exhibited a minimal change. Reduction in scar size: MRI analysis revealed a substantial reduction in myocardial scar size in the CSC-treated patients. The scar size decreased by 24 in the CSC group, indicating regeneration of viable heart tissue. Increase in myocardial mass. The CSC group experienced an increase in myocardial mass, suggesting the formation of new cardiac muscle cells. This finding supports the regenerative capacity of CSCs in restoring heart muscle integrity. Enhanced clinical outcomes. Patients treated with CSCs reported improved exercise capacity and quality of life compared to those in the placebo group. These improvements were reflected in standardized assessments such as the 6-minute walk test and quality of life questionnaires. Mechanisms of action. The study also provided insights into the potential mechanisms underlying the observed benefits of CSC therapy. These mechanisms include cardiomyogenesis. CSCs have the ability to differentiate into cardiomyocytes, the contractile cells of the heart. This process contributes to the regeneration of functional heart muscle. Paracrine effects. CSCs secrete a variety of growth factors and cytokines that promote tissue repair and angiogenesis, formation of new blood vessels. These paracrine effects enhance the survival and function of existing cardiac cells. Modulation of inflammation. CSCs may modulate the inflammatory response following myocardial injury, reducing detrimental inflammation and promoting a more favorable healing environment. Scientific evidence and supporting studies. The findings of the Lancet study are supported by a growing body of scientific evidence from preclinical and clinical studies. Several key studies have contributed to our understanding of the potential of stem cells in treating heart failure. Preclinical studies. Animal models of myocardial infarction have demonstrated the regenerative potential of stem cells. For instance, a study published in Circulation Research showed that MSCs injected into the infarcted hearts of mice improved cardiac function and reduced scar size through paracrine signaling and differentiation into cardiomyocytes. Clinical trials. Multiple clinical trials have investigated the use of different types of stem cells for heart failure. The SECURE trial, published in Journal of the American College of Cardiology, evaluated the use of autologous bone marrow-derived MSCs in patients with ischemic cardiomyopathy. The trial reported significant improvements in lung functional capacity in the treated group. Meta-analyses. Systematic reviews and meta-analyses of clinical trials have provided further evidence of the efficacy of stem cell therapy for heart failure. A meta-analysis published in BMJ analyzed data from 23 randomized controlled trials and concluded that stem cell therapy was associated with improved LF and reduced mortality in heart failure patients. Challenges and future directions. While the results of the Lancet study and supporting evidence are encouraging, several challenges and areas for future research remain. Optimizing cell delivery. Ensuring efficient and targeted delivery of stem cells to the damaged myocardium is crucial. Techniques such as intramyocardial injection, intracoronary infusion, and scaffold-based approaches are being explored to enhance cell retention and survival. Identifying optimal cell types. Different stem cell types have varying regenerative potentials. Identifying the most effective cell type or combination of cell types for heart repair is an ongoing area of research. Long-term safety and efficacy. Long-term follow-up studies are needed to assess the durability of the benefits observed with stem cell therapy and to monitor for potential adverse effects, such as arrhythmias or tumor formation. Personalized approaches. Tailoring stem cell therapies to individual patients based on factors such as the severity of heart failure, underlying etiology, and genetic profile may enhance treatment outcomes. Conclusion. The landmark study published in The Lancet demonstrated the potential of stem cells in treating heart failure, providing compelling evidence of their regenerative capacity and clinical benefits. The significant improvements in left ventricular function, reduction in scar size, and enhanced clinical outcomes observed in the study highlight the promise of stem cell therapy as a novel and effective treatment for heart failure. Supported by a growing body of scientific evidence, Stem cell-based regenerative medicine represents a transformative approach with the potential to revolutionize the management of heart failure and improve the lives of millions of patients worldwide. Continued research and clinical advancements are essential to fully realize the therapeutic potential of stem cells and to address the challenges that remain on the path to widespread clinical application.